question was, why did the CDC decide not to use the World Health Organization's test?
Do you want to talk, Dr. Red? Do you mind talking about that?
Yeah, thank you. There's a process of developing tests when there's a new disease. We followed that procedure. There wasn't a need to follow the WHO test. We developed a test very rapidly after China produced the sequence. We're in the process of validating that, and that's the test that we're going to be using.
But why is it that once we realized the first CDC test had several faulty tests, false reads, you didn't go to the WHO test, and we knew how quickly that this was spreading?
So the process, as we've described the emergency use authorization, really getting the test out and then using that initial experience to make sure that it's working the way that it's supposed to. When we found that that wasn't the case, we really looked at what was going on, and that's where the new test has come from, the one that we're talking about today.
Right, but shouldn't we have been prepared, given that we had weeks ahead of time, that we knew this was coming? We heard from health officials literally for months that this was going to spread here, that there was only a matter of time before an outbreak, and yet still the tests weren't working.
Well, we began development of the test within hours of the posting of the China sequence, so I don't think that there was any delay on our side.
So even though in South Korea, for example, they are testing 10,000 people a day once they had a diagnosis, and we took us a week. I don't even know if we have tested 10,000. As of Sunday, it was 3,600.
I think that the steps the Secretary outlined is going to ramp up our capacity to test many, many more people than we've been able to test before, and I think that's the right step at this time.
And our testing in the United States has been very consistent, if not even more aggressive than similarly impacted countries. So we are not Korea. Korea is in a very active hot zone outbreak.